Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering delegation. And the reason that delegation is so important is because it's weaved in and out of so many test questions. Whether you're in the nursing program right now and you're studying, or you've graduated and you're studying for your boards, priority delegation is weaved into med surg, OB, peds, psych, you name it. So it's something that you absolutely must understand. And if you can understand priority, if you can understand delegation, you may not know the specific topic that the question's on, but because you understand priority and delegation, you can still figure it out and get that answer correct. So I'm going to make sure you guys understand it. This is going because I got so much more to talk about. So this is definitely not going to only be a part one series. I am working on the YouTube live that I want to do. I want to do NCLEX review with you guys, YouTube live. I'm working on it because I'm not technologically savvy, and I'm trying to figure out how I can be able to share my screen on YouTube without getting an extra app, because I've got a million of them and I don't even know how to use the ones I have now. So I'm not trying to add another one or learn another one. So as soon as I figure that one out, guys, I'm going to have a live YouTube NCLEX review for you guys. All right. So anyway, before we get started, I'm going to ask you to please support my channel. If you appreciate this content that I'm bringing to you guys basically every single day, please let me know you appreciate it. Do that by supporting my channel. Like my video, comment on my video so that you can help the algorithm. Let me know what kind of videos you'd like to see next. You can support me by going onto my website and purchasing an audio lesson. I've got lots of lessons available for you. Don't forget, I also do different videos almost daily on my TikTok, Instagram, and Facebook account. So I'm asking you to please support me in any manner that you can. All right, guys, so let's get started. So at the top, what does it say? It says teaching. You cannot delegate primary education. This primary role of an RN is teaching. Now, so you need to understand this. And that is why patients who are admitted, patients who are discharged, the RN has to keep. You cannot delegate that to an LPN or an unlicensed assistive personnel. And the reason for that is because there's so much teaching involved. When it comes to first-time teaching or in-depth teaching, only the RN can do it. And I haven't done one of these videos in a while because, and this still, every time I think about it, I get annoyed. I need to ask God to just help me forget, because I still get mad when I think about it. But I remember one of my viewers sent me this long book in the comments saying how I was being disrespectful to LPNs when I'm teaching, and I tell them, if a nurse is a brand new nurse, a nurse graduate, if they've been a nurse for a long time but they've transferred to a floor that's new to them, to treat them as an LPN, which means give them the most stable patient. And she went on this long rant about how it's being so disrespectful, and I don't mean to be disrespectful if that's how it comes across, but I'm trying to teach you to pass your test. And according to NCLEX, according to ATI, according to HESI, according to your nursing exams, according to your textbooks, you have to give the LPN the most stable patient. Okay. And when it comes to in-depth assessments and in-depth teaching, the RN is responsible for it. And if I told you anything different, I would be setting you up for failure. All right. Let's keep going. Pay attention to words like chronic. A patient with a chronic disease can be delegated unless they're non-compliant. Why? Because remember, I told you, you can delegate the most stable patient to the LPN, right? But the most unstable you have to keep. If a patient has a chronic condition, that means this is something that's been going over for a long time. It's not something acutely that happened. That's something you can delegate to the LPN unless they're non-compliant. Why? Because if they're non-compliant, they're not doing what they're supposed to be doing. We don't know what we're going to expect. So that patient's going to need an in-depth assessment. And matter of fact, they're going to need in-depth teaching because they're not being compliant for a reason. So we're going to have to do an in-depth assessment, find out what's going on, find out why they're not being compliant, and then do some in-depth teaching, which the RN is responsible for. Look at this example. A diabetic patient can be delegated unless they're non-compliant, because if they are non-compliant, it means that their health becomes unpredictable. Let's keep going. Remember not to delegate the following to an unlicensed assistive personnel. When you see that UAP, they're talking about a CNA or a PCT, whatever it is that they call them in your state, but they're not licensed. They're not an LPN. They're not a registered nurse. They may have a certification. Actually, some states now, like the CNA, they call it licensed because I believe in the state of Florida, because a long time ago, I'm about to show you guys my age, once you got your certification, you had it for life. And then years ago, now you have to update it. I think it's like every 2 years. So I'm not sure if they still call it certification or license. But when you see unlicensed assistive personnel, they're talking about auxiliary healthcare workers and they're not the registered nurse or the LPN, okay? Remember, do not delegate the following to a UAP or LPN or a new nurse or LPN. Let me stop right there before I even go over that list. Let me explain why that new nurse or LPN, when they are new, they're new either to the profession or they're new to your floor. They won't understand what to look for in depth. They won't understand the teaching that they need to do in depth. They won't understand those complex situations that may arise that seasoned nurse who's been doing this for a while may, okay? That's what they mean by that. So let's take a look. Do not delegate client admission. And I've said that a million times. That takes in-depth assessment and teaching. A new admission is considered unstable, and the registered nurse must assume that responsibility. Never delegate an assessment, especially if it's initial assessment. That initial assessment needs to be done by the registered nurse. Now, that LPN or LVN can come behind the registered nurse and do the follow-ups, because guess what? The initial assessment, that's just the first assessment. But as an LPN, every time you're about to give your patient medication, don't you assess them first, or you just give them the medication? You're about to give them a hypotensive medication. You don't take that blood pressure first? So what we're saying is that initial in-depth assessment needs to be done by the RN. Case in point, the only time the RN would even consider delegating an assessment is after the initial assessment, when you allow the LP and LVN to do a follow-up on the stable client. I should have highlighted that word stable, but I don't see my highlighter. The preference on answering related test questions is to never delegate any assessment in any form. When it comes to testing purposes, if it's an assessment, don't delegate it to the LPN. You have to keep that patient. This also includes evaluation. So, all right, I did my nursing intervention. Now I got to see if it worked. The RN has to do that. As evaluating a client always includes an assessment. Do not delegate anything you can eat. Evaluate, assess, or teach. Those three, you, the RN, have to keep. Do not delegate assessment, evaluation, or nursing judgment. Look for keywords such as assess, observe, teach, monitor. All of those are ways of assessing or evaluating a patient, which the RN has to do. Do not delegate any task that requires excessive problem solving. So if it's something simple, a routine blood sugar that the nurse did, and the blood sugar is high, and the patient needs glucose, the patient needs insulin, the LPN can give the insulin. That is something that's routine, right? But what if that patient's blood glucose is so high, they're now in diabetic ketoacidosis? Is this something routine? No, this is something complex. Why? Because now, yes, the patient's going to get insulin, but besides the insulin, we got to make sure that they're getting glucose at the same time after that glucose drops to a certain level down to 250, because we got to make sure the glucose doesn't drop too fast, because that patient can start having seizures. We got to be looking at the potassium. There's so much that goes on with that patient that's in diabetic ketoacidosis. So we wouldn't give that to the LPN. Why? Because it's not routine. That is complex, and it's going to take complex decision making. Do not delegate any task that has the slightest chance of causing harm. Putting in a central line. This is an invasive procedure that has a chance of introducing pathogens, microorganisms directly into that patient's bloodstream. You can't delegate that to an LPN. The registered nurse has to do that. Let's look at this case in point. Feeding a client who has dysphagia because the client is at risk for aspiration. And you would think, okay, well, feeding a patient, I can give that to a CNA, I can give that to a PCT. Not if they have dysphagia. You can't. Why? There's a chance that they can aspirate. So if they have this, you, the RN, yeah, you got to feed that patient, because while you're feeding that patient, you're assessing them, you're watching them very closely, and you're realizing, wow, I need to call the healthcare provider and ask for a speech consult because we need a swallow study. You can't delegate that. You, the RN, have to keep that patient. Look at this, ambulating a client who recently had hip surgery. They just had hip surgery. You can't delegate that to an LPN. You can't delegate that to a CNA. You need to walk that patient the first time after that hip surgery. Why? Because while you're helping them ambulate, you're assessing them from head to toe, and you're realizing, whoa, I got to call the healthcare provider. Let's get a physical therapy consult. Let's get, a walker consult. With the physical therapy consult, they can evaluate the patient, see if they need a walker, crutches, whatever. But you're not going to know that unless you're the one assessing that patient during that first ambulation. So you can't give that to the CNA or the LPN. Feeding, ambulating, taking vital signs would normally be routine tasks. However, in this case, there is potential that these may result in harm due to the instability of the client. So therefore, you can't delegate them to the UAP or the LPN. I'll give you another example that of the dysphagia. How about the patient who just had a stroke? They had a stroke, and this is their first meal after that stroke. They have no history of dysphagia, but because they had a stroke, that first feeding, you want to do it to see if there are any issues with swallowing, any issues with aspiration. Something else that only you, the RN, can do is call the healthcare provider to request a consult, to request DME, to request home health. Only you, the RN, can create that care plan. The UAP and the LPN, they follow the care plan that you created, but only you can create it. How do you know what to put in that care plan? By assessing your patient in depth. Okay. Do not delegate your care plan. You have to do that. Do not delegate teaching. The LPN can reinforce the teaching. So for example, you got a patient just got admitted, they had hypertensive crisis, they're on these antihypertensive meds, and you're teaching the patient how important it is to stay away from foods with high salt. That's that first teaching. Now the LPN can come behind you and reinforce that teaching. They see that big old salt, I don't know what you call it, container, the pepper and the salt, and they see that patient just shaking it over the food, and they can say, oh, Mr. Such and such, remember, you're not supposed to be eating foods high in salt. Go ahead, let me get that for you. But the initial teaching has to be by the RN. Do not delegate telephone advice. What is telephone advice? Isn't that a form of teaching? Excuse me, guys. I've been making videos all morning, so my voice is sore. But yeah, that's teaching, right? So if something's going on with a patient via phone and that patient's not even there for you to physically look at them and assess them, you go to the phone so that you can ask questions. Remember, assessment is not only physically examining that patient. Anything you do to get information, such as asking questions, that's a form of assessment. And the more you listen, the more you hear what that patient's saying, and you realize this problem is much bigger than we thought it was, or this problem is different than we thought it was. So you can be on the phone and provide teaching to the patient, or even say, hey, you need to come in because the healthcare provider needs to see you. There's nothing we can do for you over the phone, but that's your responsibility as the RN. Do not delegate handling of any invasive lines. Remember, anything that's invasive, there is a chance of giving that patient an infection. The testing world is not the same thing as the real world. In the real world, we see LPNs do it all the time. But for testing purposes, you, the registered nurse, is going to keep that type of patient. And they give you examples such as your central lines, your arterial lines, your swan guns, your PICC lines, etc. Patient who just received surgical procedure. Let's talk about this. A patient who just had surgery is not stable. They are unstable. They are at high risk for infection. They are at high risk for hemorrhage. They are at high risk for developing a DVT, or that DVT traveling to their lungs and now turning into a pulmonary embolism. They're not stable. You have to keep that patient. Patients who need advanced, look at this keyword. Where's my highlighter? I don't know. Oh, here it is. Why do you think they put this descriptive word in front of infection? Advanced infection control measures, because as a nurse, RN or LPN, even CNAs, right? We all do prevention control measures, but advanced infection control measures, you, the RN, you keep those type of patients. Your meningitis patient, that's in isolation. You, the RN, you're keeping that patient. Your TB patient, you're keeping that patient. So those advanced infection control measures, that neutropenic patient with leukemia, you're keeping that patient, okay? That's the key word, advanced. Never never delegate discharge planning or any skill that requires judgment skills. Why? If a patient's being discharged, they're going to require in-depth assessment before you let them go. They're going to require in-depth teaching before you let them go. They're going to require in-depth case management. And guess who has to do all this coordination of care? You, the registered nurse. You're the one who has to pick up the phone and call the healthcare provider and ask for a social worker to be on the case, for a case manager to be on the case, for home health, for DME, all of that. You, the RN, has to ask for those orders, okay? However, if a patient's being discharged, they usually considered stable, thus can usually be delegated unless there's a mention of, what's this word, guys? Planning. Planning the discharge. Don't assume someone's competent to do something just because of their job description. That's something else that you guys have to understand. As a registered nurse, just because you delegate something doesn't mean that's no longer your responsibility. It's still your responsibility. It's still your job to make sure whatever you're delegating is within that person's scope of practice that you're delegating it to. Two, not only does it have to be within their scope of practice, you have to make sure that they're competent to do whatever it is that you're delegating. And then number three, it's your responsibility to come behind them and make sure that it was done properly. Because if it wasn't, guess what? Your license is on the line. Your license and whoever you delegated to, not just that person that you delegated it to. So that is very, very, very important. When you, the RN, identify a weakness, you are supposed to teach. When all staff members are pulled to a new floor, you should pretend they are brand new. So that means, guys, even if a nurse has been a nurse for 20 years, if they're new to your floor, you're going to treat them like you would a nurse grad. You're going to treat them like you would an LPN, which means you're going to give them the most stable patient, the patient with the least amount of complications that can kill them. Let's look at this example. During an interview of a prospective employee who just completed the agency application, which approach should a nurse manager use to assess the skills, competence of this potential employee? A, let's review your skills checklist for type and level of skills tasks. B, let's talk about your comfort. What does it say? Let's talk about your comfort zones for working independently. C, what degree of supervision for basic care do you think you'll need? Or D, what type of complex client care tasks or assignments do you prefer? And the correct answer is A. Let's talk about your skills. Let's talk about your skills checklist for type and level of skill for task. And what you're going to do is compare that against what you have going on your floor and your needs to see exactly where this nurse would fit in and if they're going to be competent for the type of care your patients need on your floor. You need to know the nurse's capabilities so you know what to assign them and what you need to, what's that word, guys? Teach. You better teach and you better follow up. That's your license on the line. Anything that you delegate, that's your license on the line. Now let's talk about teaching for a second before I move on. I'm getting off topic, but I gotta make sure you guys know this. Before you teach, as a nurse, before you start teaching, you always need to assess the level of knowledge. So before you start teaching, you say to them, tell me what you know about XYZ, whatever it is you're going to teach. Because as they're talking, you're realizing, well, whoa, I was going to start here, but they're all the way up here. They know their stuff. I only need to do a little bit of teaching. Or you realize I was going to start here, but oh man, they know nothing. I got to start it all the way down here. So you always assess, ask them first, what do you know? Then you do your teaching, and then you have to evaluate if your teaching was effective. So you say to them, okay, I need you to explain to me what I just taught you, or I need you to do a return demonstration. You have to do something to see if your teaching was effective, okay? All right, let's talk about floating. When a nurse is floated to another floor, assignments must be made according to the nurse's ability. Assigning an ICU nurse who floated to labor and delivery to take care of a patient who's in full labor is not a good choice. Why? Because they know nothing about labor and delivery. They've been working in the ER for all those years. Nor is it wise to assign a floored nurse who floated to the ER to take care of a person who's in full cardiac arrest. On the other hand, all nurses know how to give blood, how to interpret vital signs, and how to give medications. So what is this telling us? This is telling us if you have a nurse that is floating to your floor, always give them the patient that has like the most routine tasks that any nurse can do. And the only exception to this rule, guys, is if you have a nurse that's floating to your floor that you happen to have a patient that matches that nurse's background. If that happens, then yes, you can put those two together. But otherwise, you're going to always give them the most unstable patient, You're always going to give them the most stable patient with the most routine needs, okay? So let's look at this question. It says an RN with 15 years experience in the ER is pulled to the labor and delivery unit. Which client should be assigned to the nurse? A, client with DVT. B, client in active labor. C, client who's 8 hours postpartum. Or D, the client requiring fetal monitoring. Well, this nurse was working in the ER for 15 years. So who are we going to link them up with? The client with DVT. Because the client in labor, 8 hours postpartum, fetal monitoring, when's the last time they dealt with any of those type of patients? So the most stable patient here for that nurse is going to be that client that's DVT. And let me not say the most stable patient, because when we look at this list, they're really not the most stable patient, but this is the exception to the rule. Remember, I told you when you have a nurse floating to your floor, you're always going to give them the most stable patient, unless you happen to have a patient that whatever their diagnosis is, that matches your nurse's background. Our nurse came from the ER. She's seen plenty of DVTs. So that's why we're matching her up with this DVT patient. Not the client who's 8 hours postpartum, because that client who's 8 hours this list, that client who's 8 hours postpartum, they are the most stable patient. But because her background is ER, for her, the best patient to, I keep saying her, gentlemen, I'm so sorry. I know you guys watch me as well. I'm sorry. We have our male or female nurse, he or her, right? The best patient would be the one with the DVT because it matches his or her background. And lastly, Assign a nurse according to the base of their experience and specialty. I just explained that to you. A cardiac nurse comes to the ER should be assigned a cardiac patient. A labor and delivery nurse that comes to the med-surg floor should be assigned a pregnant patient, etc. So make sure you guys know your specialties. Do not give this nurse any patients that requires specialized care, because they wouldn't know what that specialized care is because they never worked on that floor. All right, guys, I promise there's more to come. I'm really trying to get this together for you. Please, if you appreciated this video, you appreciate the videos that I bring your way, please don't forget to support my channel by dropping a comment in. Let me know what you thought about this video. Let me know what you'd like to see on the next videos. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. Don't forget to like and subscribe to this channel, and you guys will see me on my next video.